Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm out at the Scottsdale Air Park, which is the second busiest single runway airport in the country. I think it's behind San Diego, which only has one runway. Could be wrong on that. The air park itself is not just an airport. It was, in the 1940s, it began as a training facility for World War II pilots, and in the 1960s, the city took it over, and in funding part of the renovation, they also purchased thousands of acres around the air park. So now the air park is home to about 25 national and regional companies, 2,500 small to medium-sized businesses, and accounts, the airport itself, about $180 million of revenue a year. The air park, the whole thing, is around $3 billion of revenue a year. So there's over 450 jets and small aircraft here. Very impressive little slice of Scottsdale. The topic for today is chronic pain management in the United States and how it's flawed. I just wanted to discuss this a little bit because it is a significant problem that we do have an answer for, and that answer is becoming more and more popular. And the answer is actually how Preferred Pain Center goes about its business. So here's the problem. Over 20% of doctor visits in the United States involves a narcotic prescription. The cost of pain management, both direct and indirect in this country, is over $500 billion a year. And on top of that, 1 in 3 Americans suffers chronically from some sort of pain. The statistic I've seen before is really 15% live in severe chronic pain, but that's still an impressive figure. So here's the way it normally works. For either an acute or a chronic painful condition, the patient will go to either an urgent care or their doctor's office or their orthopedic doctor's office, and they'll get evaluated for the condition. Well, traditionally, what do we have to offer? First and foremost is pain medication. Patients in pain prescribe something like Vicodin, which, by the way, Vicodin is the #1 prescribed medication in the whole country. So there's a reason for that. That's the way that traditionally doctors are taught, in either as an MD or a DO. That is just the way that it is in this country. Another thing that people often do is physical therapy, and those are really the 2 main components of what we're talking about. There's also non-narcotic pain medications that you can get over the counter, like ibuprofen or anti-inflammatory products, Tylenol. But what you see too often in this country is narcotic prescriptions being handed out like jelly beans. And the problem is that the human body develops tolerance and potentially addiction to narcotic medications. So patients get over the acute painful condition, but they've developed a physical addiction to the narcotic medication, so they keep taking it. Or, for instance, they might have a degenerative disc disease condition which has a baseline pain each day, but over time, the narcotic medication that's being given, say here, was doing fine before. Now the condition hasn't changed, but this isn't enough. So the pain doctor or whoever's prescribing has to prescribe more to get the same pain relief, and oh look, now you need to prescribe more. It is a vicious cycle, and that is why the condition of pain management, the treatment, is flawed in this country. So there was a 2006 study done in the Journal of Pain, which showed that integrative medical approaches to pain have better outcomes. Well, what does that mean? Well, integrative medicine refers to multidisciplinary. So a discipline would be, a pain doctor, or a physical therapist, or a naturopathic doctor, or a chiropractor. Different methods of thinking and treatment to pain management, when they come together in an integrated approach, can treat pain better and get better outcomes. You can decrease the need for narcotic medications. You can decrease the pain itself without narcotics and get the patient back to better living, better social interactions, getting back to work, getting off of disability. These are the things that can help decrease that $500 billion a year cost. So let me just give a couple specific examples of how the system is, we talked about how it's flawed, how it can be fixed. So at Preferred Pain Center, we had a patient last year who was a poker dealer at a casino. He had a lot of trouble getting the chips off of the table because his shoulder was a huge problem. He couldn't sleep at night, he couldn't lift up his young children, and he couldn't make it through a full shift without needing some kind of pain medication that, believe me, can be very mind-altering to patients. So he met with our pain doctor, our chiropractor, and our rehab doctor. And the three of them together developed a treatment plan that was able to minimize the need for narcotics. He was taking some non-narcotic pain medication, some muscle relaxers for a short time, and then because of the neuropathic type of pain, he was able to take gabapentin, which is Neurontin, then that helps substantially as well, and that's not addictive. So he had physical therapy, he had some injections. It was found between the three doctors that a lot of his pain was coming from his neck and not his shoulder. He had some pinched nerves. So the diagnosis was clarified and his treatment was spread across multiple disciplines that were integrative. So within 6 weeks, the patient was able to play with his children, he was able to make it through a full shift of work repetitively, and he was able to sleep better, all while having a minimal amount of narcotics. So that's a type of treatment that is modern, revolutionary, cutting edge, and so it's not just, oh, we have better procedures to give you, or we have newer narcotics to give you. It's the integrative approach. So the system is flawed. This is how we're going to fix it. Preferred Pain Center uses this type of approach. Our website has a ton of information regarding it, preferredpaincenter.com. There's also a blog with a lot of information about pain. Call us today at 602-507-6550. We have a 24-hour guarantee. We'll get you in within that time to start your pain management treatment. I'm Dr. David Greene, CEO of Preferred Pain Center. Your pain stops here.